Hello, welcome to my YouTube channel. Today in this video I am going to tell you the physiological lobes of liver. So here with me there is a model of liver. Anatomically there are two lobes are there, two anatomical lobes are there. You know that there is a right lobe and left lobe. Okay, so the ligaments which divides the liver into two right and left lobes are, we have anteriorly there is a falciform ligament, and posteriorly there is the ligamentum venosum. So these two then we have the ligamentum teres also. Okay, so these three ligaments divides the whole of the liver into right hemiliver and left hemiliver, normally you call right lobe and left lobe. In addition, on the visceral surface we have the caudate lobe here and there is quadrate lobe. This is a caudate lobe and quadrate lobe. Okay, now these are the anatomical lobes. Okay, what do you mean by physiological lobes or functional lobes of liver? At the porta hepatis, three structures are present. There is a portal vein, hepatic artery and bile duct. Okay, intrahepatic distribution of these structures is a portal vein, hepatic artery and bile duct. Okay, based on the intrahepatic distribution of portal vein, hepatic artery and bile duct, the whole of the liver is divided into 8 segments. So these functional lobes or the segments are known as the Couinaud's segments of liver. Okay, so today in this video we are going to learn these 8 segments. Okay, now in here the lobe is divided into the liver is divided into 2 functional lobes. Okay, we have the right functional lobe and the left functional lobes. Okay, and there is an imaginary line that is known as a Cantley's line. It's an imaginary. So let us draw this Cantley's line. Here 2 structures, one more. Here we have the gallbladder and this is the inferior vena cava. See here the vessel surface, you can see the gallbladder over here and here comes the inferior vena cava. Okay, so what do you mean? What is the Cantley's line? If you draw an imaginary line, okay, passing through the gallbladder, that means the fundus of gallbladder, connecting the fundus of gallbladder, okay, and to the inferior vena cava. So we have the gallbladder here and to the inferior vena cava. Okay, so we made an imaginary line. Okay, anteriorly the Cantley's line passing from the gallbladder and a fossa for the gallbladder to the inferior vena cava. What about posterior aspect? You can see posteriorly again it starts from this inferior vena cava. Okay, but one thing you should remember, it equally divides the caudate lobe. I already told you this is the caudate lobe of the liver and it passes through the caudate lobe. Okay, and it divides the caudate lobe into 2 halves, then it runs downwards towards the gallbladder. So remember this one, on the posterior part the Cantley's line divide the liver, Cantley's line divides the caudate lobe into equal halves. That means the caudate lobe functionally belongs to both the right and left lobe. You got my point. Okay, now this Cantley's line divides the liver into right functional lobe and the left functional lobe. Okay, now there is another line along the right surface. This is the right surface of the liver. This is an anterior surface, the superior surface, right surface, and we have the posterior surface, inferior surface. The whole is a visceral surface, you know that. Okay, along the right surface of the liver there is an imaginary line. Okay, I am drawing an imaginary line on the right surface. This right surface, okay, this particular line divide the right lobe into 2. There is an anterior segment and posterior segment. This line over here, this is the anterior segment and posteriorly we have the posterior segment. But what about on the left lobe? Okay, left lobe is again divided by imaginary line. So I am drawing an imaginary line over here. As a result we are getting there is a lateral half and medial half. As a result, on the right side or on the right lobe we are getting 2 segments, that is the anterior segment and posterior segment. But on the left lobe we are having a lateral segment and medial segment. Okay, again there is a transverse line. Okay, I am drawing a transverse line from here. See the transverse line, Transverse line divides the whole of the liver into an upper segment and lower segment, upper segment and lower segment. As a result, how many lobes are there? On the right lobe, we are having 4 segments are there. That is, these are antero-superior, antero-inferior, posto-superior, posto-inferior. I repeat, on the right side, on the right hemiliver, we are having antero-superior segment, antero-inferior segment, posto-inferior and posto-superior. But on the left side, we are having on the medial part, medial and the lateral aspect. You know? So, medial, there is a medial superior, medial inferior, lateral superior, lateral inferior. So, total we are getting 8 segments, 4 on right side, 4 on left side. Okay, we can number this one. So, the number 1, this corresponds to the number 1. So, here we have the number 1 first, here is the second, this is the third, comes the fourth, fifth, sixth, seventh and eighth. There are 8 are there. Once again, here is the first one, here is the second one, then comes the third one, then the fourth one, fifth, sixth, 7 and 8. These 8 segments are there. So, these 8 segments constitute the Couinaud's segments of liver, Couinaud's segments of liver. Okay. So, now let us see how to draw the surgical segments of liver. Let us draw the liver. Here is a liver, here for the gallbladder, here is inferior vena cava, and this is the Cantley's line. Okay. So, on the right lobe, there is an imaginary plane which divides the right lobe into an anterior segment and a posterior segment. This is a posterior segment. On the left lobe, there is a line which divides it into lateral segment and there is a medial segment. Okay. Again, the whole of the right and the left lobe is divided like this into a segment above. There is an upper segment and the lower segment. Okay. Now let us number it. So, here this is the first segment, second segment, third segment, fourth, fifth, sixth, seventh and eighth. Okay. Now let us write the hepatic segments on the right lobe. On the right lobe, what are they? This one is number 8. Right anterior superior, right anterior superior. This is the right anterior inferior, right anterior inferior. What is the number? 5. Okay. Then 6 is right posterior inferior. Then we have the 7th one, right posterior superior. Okay. Then on the left lobe, what are segments? The number 1, what is that? Left medial superior, medial superior, and the number 2 is left lateral superior. You know, this is left lateral superior. Number 3 is left lateral inferior, left lateral inferior. Number 4 is left medial inferior. So these are the Couinaud's surgical segments of liver, right? Now I am going to draw one more diagram. Just see. So here we have the first segment, second, third, fourth, fifth, sixth, seventh and eight segments are there. This is based on the, I already discussed that it is based on the intrahepatic distribution of portal vein, hepatic artery and bile duct. Okay, so I'm drawing the portal vein here. Suppose here we have the portal vein, it gives a branch to his, and it gives a branch to this one, then to this, and to this segment. This is the portal vein. Portal vein distributes this one. Then the hepatic veins are formed. 3 hepatic veins are there, and these 3 hepatic veins are present in between these hepatic segments. Okay, so here we have one hepatic vein, we have another hepatic vein, and we have the third one here. Okay, these 3 hepatic veins opens into IVC, inferior vena cava. This is inferior vena cava. Okay, now this is the left hepatic vein, this is the intermediate hepatic vein, and this is the right hepatic vein. Okay, what are the areas of drainage of these hepatic veins? See, very easy to remember. The right hepatic veins drains the posto-superior, posto-inferior, andro-superior. This is a posto-superior segment, this is a posto-inferior segment, and this is the andro-superior segment. Then what about the left hepatic vein? This is left superior, left inferior and right superior. Okay, and the remaining, that is the right anterior inferior and the left medial inferior. So these are drained by this one. So we are having these 3 hepatic veins drains these segmental lobes of the liver and drains into inferior vena cava. There is something called surgical resection of liver. So we have already discussed that unlike the bronchopulmonary segment, these hepatic segments are not independent. Bronchopulmonary segments are independent units, but these hepatic segments are not independent, not individual units. Okay, they are overlapped with each other. Okay, so here the surgical resection follows the intersegmental hepatic veins. These hepatic veins are intersegmental. Okay, for example, so this is the right lobe, and here we have the left functional lobe of liver. Okay, if we want to resect this right lobe, the incision should be given just right of this right hepatic vein. If you want to resect the left one, okay, the incision should be given left of this left hepatic vein. So this left hepatic vein, these hepatic veins acts as a plane to which the surgical resections are done. Okay, if you want to resect this one, incision will be given right of this right hepatic vein. If to resect this area, so the surgeon follows this particular hepatic vein and makes resection over here. Okay, so that is the importance of this hepatic vein. Okay, and the surgical resection is, or segmental resection is not possible just like that of the bronchopulmonary segment, and still it is possible only because of the hepatocytes, the regenerating power of hepatocytes. Even if a healthy part of the liver being cut, it will regenerate. It will regenerate. Okay, hope you understood. So that was all about the hepatic segments of liver. Hope you enjoyed the video. If you find the video useful, please like it and share it with your friends. Thank you so much.